All right, good morning. Happy Thursday. Couple minutes late, but that's okay. So this morning I'm going to talk about a topic that's near and dear to my heart. It's something I've really been learning and over the years from different mentors and such, and then applying and practicing in my own life. And it's really what helped me get through a low back injury, my cesarean, colon cancer and surgery, all these various things. It's often the missing link in a lot of healing programs. So I know some of you go to chiropractors, they go to acupuncturists, physical therapists, or maybe you're Googling or you're getting a random YouTube video here or there, and you have a whole bunch of exercises that you can do at home, stretches, strengthening, core work, but yet you don't seem to completely get better or heal fully. Or some days you feel better and you're like, yeah, this is working for me, and then other days you wake up and you're super sore or achy and you're just not even able to do your work because you can't sit because your back's bothering you, and you're like, what the heck, I'm doing all the right stuff, like what is going on? So this is often the missing link that is when it's not completed, you don't get that complete healing. And I'm honored to bring on the podcast yoga teacher and psychologist Leslie Boyd, and she talks a lot about this missing link, and it's working with the subconscious. So in my podcast, I've been going through the kosha layers, and this really has to do with the third and fourth layer of healing of the kosha models. So it's getting behind the scenes of what's going on in your brain and taking a step back from that place of an observer so you can create an awareness of patterns of what you're thinking or how you're moving. Because let's take that example. If you're the person Google searching and you're grabbing a random exercise or a random stretch or a random core workout here and there, and you're trying to piecemeal it together into this program that's, hopefully to help heal your low back, right? But if you never assess like what you're doing in the day-to-day, like what's happening when you're actually sitting at the desk, what's happening when you're bending forward to pick up your kid, or how are you going through your chaturanga sequence or flow in your yoga class, or even if you're doing a deep stretch, a more restorative type, slower hatha class, what are you actually doing in the asana? And it really requires to disrupt your pattern. So a lot of us just move unconsciously throughout our day. We're going from one activity to the next, and we're not stopping and actually integrating or feeling the consequences of either how we're moving or how we're thinking, for example. And it's when you actually take the time to notice what's going on in a moment, like, okay, let's say you're doing a hamstring stretch, for example, something very, very good for you, or a core strengthener. What's the consequence of that particular action? Did you pull and yank on the strap and really over stretch the nerve and you don't even know because you just are doing the motion because the Google video said to? Or are you doing a core strengthener and over activating your core and your pelvic floor muscles, and you're creating too much pressure in the system and aggravating your discs? How do you know? Until you take a step back and actually observe the consequences following your action. So it's disrupting patterns of even things that you're trying to do to help yourself, but it's also disrupting patterns of your normal day-to-day motions of how you twist and reach in the car or bend forward to pick something off the ground, because some of these patterns will serve you well, right? We have these unconscious patterns to be efficient human beings. Or sometimes We have stored when an uncomfortable feeling comes up, for example, let's say sadness, disappointment, grief, stress, fear, worry, anxiety, right? We have patterns of either how we resist those emotions, how we might store them in our body, especially if it's a traumatic experience. All this sort of stuff, like you need to take a step back. So let's use another example. You have low back pain, right? It kind of comes and goes, and it's not too prevalent in your life. Just every so often, it'll sneak up, and you've been kind of ignoring it because it'll go away eventually, or you have this one trick that you do and you make it go away. And so far, that's been working. But what happens is on occasion, because I see this a lot in my clinic, is that it'll start to get worse. Good morning. I can't see any comments this morning, so if you guys are, maybe comment below. Let me know your thoughts. If you have any stories you want to contribute, if you have a question, I'll cycle through after the live and get back to you. So for whatever reason, comments aren't popping up. So let's say that low back aches and soreness, it starts to increase. What is your thought about that increase in pain? This just happened in the clinic. I just had like 3 or 4 patients come into my clinic with this scenario. One of them was low back pain, one of them was a nerve pain down the arm, neck pain, and an SI joint dysfunction. So different areas of the body. But the common theme was this aches and pain started off pretty mild and then slowly got worse. And as it got worse, their worries, their stress, their negative thoughts surrounding what was going on in their body skyrocketed. And as those concerns and worries skyrocketed, then that exacerbated and fueled the stress in their bodies. So the muscles actually clamped down some. Their inflammatory process increased, and then they started scrambling. So instead of moving and taking action from a place where they were trusting their body, they had a complete program to help with their healing, a practitioner that they trusted, so they can move from a place of abundance and confidence and belief in themselves. Then they started, the contra happened. They started hustling and scrambling from a place of insecurity. They didn't know what was happening with their body. They were freaked out. They were really worried it was going to get worse. Some of them were moving into their 40s or 50s, so they're like, shoot, it's all going to go downhill from here. It's just going to get worse. My body's just going to get worse. So you see 2 very different mindsets, and those, but same issue, right? Can have a drastic impact on how they heal. So the person moving from scarcity and fear and confusion is going to fuel their fight or flight response, right? Their brain is going danger, danger, danger. All these other different hormones and physiological properties are happening in their body, versus the person that is taking action from confidence and abundance and belief that their body will heal, trust in their practitioner and their program. They're going to be moving. Yes, the sympathetic nervous system will still, the fight or flight response will still be activated, but it's not going to be the primary driver. They're going to be able to move from the fight or flight and rest and digest and help to aid their body in healing. So they're going to get better a lot quicker. And when they actually do feel better, more like themselves, they're going to stay that way more frequently. So it's completely different what happens. And it really just has to do with the mind. It's just the thought of what's going on in our body and how we react to those thoughts. And it's a choice that you can make in the moment, right? You feel the back pain and you can think, am I going to worry, be concerned about this and scramble? Or do I trust myself? Do I trust my practitioner, my program, and I believe that my body can heal, right? You actually have a choice to make. The problem is that we're moving so quickly from one thing to the next. Especially this time of year, we have our holiday lists, our to-do lists, our responsibilities, that we completely miss this step. We completely miss this choice. And then we kind of just spin out of control a lot of times. And then that's when I see someone in my office, they've seen 4 or 5 practitioners, or even gone to their MD, and the MD has fueled that worry and concern because the MD is like, nothing we can do, just here's some pain pills, right? But I want to let you guys know, especially in this holiday season, that if you slow down and really come from a place of observer and just noticing what's happening in the background, what's happening in your thoughts, what are these subconscious patterns that's going on, and then from there make a choice. And it's without judgment or criticism, right? Because we're all human. So we're all going to have times where we feel emotions that are very uncomfortable, or make choices that we just don't even know the consequence to, or we make the wrong choice. But you have opportunities in the future to learn from all of that and then recorrect. So if you want to learn more about this, more from the psychology perspective, you can head to the podcast, listen to Leslie. She has a wealth of information to provide, and she works more with traumatic experience as well. So those of you that have had any trauma experiences in your life, this podcast episode is definitely for you. If you feel stuck and you want to dive deeper into this area, you finally want to get rid of your low back pain, or at least stop worrying about it, then I do have a free online masterclass. It's coming up right after the new year. I woke up this morning, 5 seats were already gone. So make sure you save your spot. Head over to the website, igniteyourwellness.com, go to classes, and then there's a free online masterclass. Get registered for that. If you can't find that link, just message me. I'll get you in, no problem. But register for it now, because it's only going to happen this one time right now in the beginning of the year. I probably won't do it again till spring, maybe fall. So don't miss it now. And I hope you all have a very, very good week. I'll see you next week for another Facebook Live, and then we're getting close to the holidays. So if you want to hear about a specific topic or anything, just you can comment below, message me, any of these things. I'll get it up. And have a great Thursday. Bye.